Breast cancer is one of the most common types of cancer affecting women globally. However, it's important to note that men can also develop breast cancer, albeit less frequently. It occurs when cells in the breast begin to grow out of control, forming a tumor that can often be seen on a mammogram or felt as a lump. This article aims to provide a comprehensive understanding of breast cancer, its causes, diagnosis, treatment, and prevention. What is breast cancer? Breast cancer originates from the breast cells, usually from the ducts that transport milk to the nipple or the glands that produce milk. It can also commence from the tissues of the breast, known as stromal tissues. A malignant tumor can spread, metastasize, to other parts of the body. When breast cancer starts in the cells of the lobules, it is called lobular carcinoma, while if it begins in the ducts, it is known as ductal carcinoma. Causes and risk factors. The exact cause of breast cancer remains unclear. However, there are identified risk factors associated with the disease. 1. Age and gender. The risk of breast cancer increases with age, with most breast cancers diagnosed after age 50. 1. While it can occur in men, breast cancer is far more common in women. 2. Genetics and family history. Women with certain mutations in the BRCA1 and BRCA2 genes have a higher risk of developing breast and ovarian cancer. 2. A family history of breast cancer can also increase the risk. 3. Personal history of breast conditions or cancer. Women who've had breast cancer before, certain non-cancerous breast conditions, or some types of cancer, have an increased risk of breast cancer. 4. Radiation exposure. Women who had radiation therapy to the chest as children or young adults have a significantly increased risk. 5. Lifestyle factors. Lack of physical activity, poor diet, obesity, and excessive alcohol use can increase a woman's risk of breast cancer. 6. Hormonal factors. Certain factors, such as early menstruation, late menopause, having your first child at an older age, or never having given birth can also raise your risk. Diagnosis. Breast cancer is often detected during a screening examination, before symptoms have developed, or after a woman notices a lump. The primary steps for diagnosing breast cancer involve a physical exam, mammography, ultrasound, and a biopsy. Further tests, such as magnetic resonance imaging, MRI, might be used to evaluate or stage the breast cancer. Treatment. Breast cancer treatment varies depending on the type of breast cancer and its stage. It often involves a combination of surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy drugs, and possibly immunotherapy. In many cases, a team of doctors will work with the patient to determine the best treatment options. 1. Surgery. It ranges from a lumpectomy, removal of the lump and a small amount of surrounding tissue, to a mastectomy, removal of all breast tissue. 1. Sometimes lymph nodes are also removed for testing. 2. Radiation therapy. It uses high-powered beams of energy to kill cancer cells. 2. It's typically used after surgery to eliminate any remaining cancer cells. 3. Chemotherapy. It uses drugs to destroy fast-growing cells, including cancer cells. 3. Chemotherapy is often used before surgery to shrink a tumor, making it easier to remove. 4. Hormone therapy. It's used to treat cancers that are sensitive to hormones. 4. Some breast cancers are stimulated to grow by the hormones estrogen and progesterone. 5. Targeted therapy drugs. They specifically target cancer cells. 5. The drugs target certain abnormalities within cancer cells, blocking their growth and spread. 5. Examples include trastuzumab, Herceptin, and palbociclib, Ibrance. 6. Immunotherapy. It uses the body's immune system to fight cancer. 6. Immunotherapy treatments are currently under study for many types of cancer, including breast cancer. Prevention. While there's no guaranteed way to prevent breast cancer, certain measures might help. These include 1. Maintaining a healthy lifestyle. Regular exercise and a healthy diet rich in fruits, vegetables, lean protein, and low in saturated fats can help maintain a healthy weight, which can reduce the risk of breast cancer. 2. Limit alcohol and avoid smoking. Limiting alcohol intake to a moderate level, up to 1 drink a day for women, or abstaining entirely can lower the risk. 2. Similarly, avoiding smoking, particularly before the first childbirth, can also be preventive. 3. Early and regular screening. Regular mammograms and self-examinations can detect abnormalities early when they are most treatable. 4. Risk reduction for high-risk women. Women at high risk of breast cancer may consider medications or surgery to reduce their risk. Breast cancer remains a significant health concern worldwide. However, the rate of survival continues to improve due to advancements in detection and treatment. Understanding the risks and the importance of early detection can empower women and men to take proactive steps toward prevention and timely treatment. It is essential for everyone to consult with their healthcare provider for personalized advice regarding breast health, screening options, and potential risk factors. Because every individual is unique, the approach to breast cancer prevention, diagnosis, and treatment should also be personalized to suit each person's specific needs and circumstances.